Hi, I am Killa. On this occasion, I will talk about 5 common signs of heart disease that you should to know. Knowing the early 5 common signs of heart disease can help you receive the best treatment before it becomes serious or even life-threatening. So let's get started with a closer look at what heart disease is first. Heart disease is one of the leading health risks facing men today. According to the American Heart Association, AHA, more than 1 in 3 adult men has heart disease. Heart disease is not a single ailment or condition. It refers conditions in which the blood vessels that supply blood to the heart get damaged, or the heart is not able to function in a normal way. Heart disease includes heart failure, coronary artery disease, arrhythmias, angina, and other heart-related infections, irregularities, and birth defects. Earlier, it was believed that heart disease affects mainly the older population. But nowadays, the number of young adults suffering from heart disease is increasing and is almost nearing the percentage of older population with heart disease. This is mainly due to sedentary lifestyle and poor eating habits that people follow. Heart disease takes years to progress and may begin to develop at a very young age. However, most people do not show any signs of heart diseases before they reach their 50s or 60s. A heart attack occurs when heart disease has reached the point where blood stops flowing to the muscle. Knowing how to identify the early signs of heart disease will help you to choose the best way as your doctor recommended to you. And here are 5 common signs of heart disease that you should not ignore. 1. Angina. The first common sign of heart disease is angina. If your coronary arteries become partially blocked, it can cause chest pain, or medically known as angina. The characteristic chest pain of a heart attack has been described as a sense of pressure, squeezing, fullness, or pain that starts in the center of the chest. The pain or discomfort typically lasts more than a few minutes, or it may go away and then return. It can spread down to the arms, neck, jaw, back, or stomach. The chest pain happens because there isn't enough blood flowing to part of your heart. And it occurs when something blocks the arteries or there is a decreased blood flow in the arteries that bring oxygen-rich blood to your heart. In some cases, chest pain is associated with inflammation of the tissue covering the heart, pericardium. The type and duration of chest pain is also indicative of the underlying heart disease. Pain may be described as short-term, constant, stabbing, or sharp. It can last for a few seconds or for hours together. If you feel pressure or a squeezing in your chest, it may be angina. It can feel like a heart attack, but often it's a warning sign. If you have unexplained chest pain or angina, you should know that it has many possible causes. The only way to confirm its cause is to have a doctor evaluate you. 2. Dyspnea. The second common sign of heart disease is dyspnea. Feeling short of breath or like you are gasping for air is also a warning sign of heart attack. Shortness or breath, or difficulty breathing, is medically known as dyspnea. Shortness of breath may occur before or during the chest pain of a heart attack, and in some cases, it may be associated with other heart attack symptoms without any chest pain. Breathlessness or shortness of breath is commonly encountered in patients with heart disease or heart failure. Breathing difficulty while exercising or any other physical exertion may indicate a problem with the heart valves. Shortness of breath occurs because blood in the body backs up in the blood vessels, which return blood from the lungs to the heart, due to the heart not pumping blood out of the heart effectively. This causes fluid to leak into the lungs. But it can also be due to inflammation and weakening of the heart muscle, cardiomyopathy, which results in improper contraction. If you experience severe and persistent shortness of breath or dyspnea, you should contact your doctor for advice and get the best treatment. 3. Swelling of feet. The third common sign of heart disease is swelling of feet. Swelling in the feet and ankles is seen in people with congestive heart failure where the blood pumping capacity of the heart reduces. This affects the kidneys, which respond by retaining more fluid in body. The fluid then accumulates in the feet and other parts of the body. While it's also true that some swelling occurs naturally throughout the day and tends to resolve overnight, persistent swelling is problematic. People who have constant or worsening swelling of the feet or legs should see a doctor for an evaluation of heart failure. 4. Unusual fatigue. The fourth common sign of heart diseases is unusual fatigue. We always associate chest pain with heart attacks, while chest pain is the most common sign of a heart attack, but women can have symptoms that aren't related to chest pain at all. They need to be on the lookout for other signs such as unusual fatigue. Like many women, you're probably busy most of the time. You may take care of a family, run a household, work outside the home and care for aging parents. You are probably also tired a lot of the time. Most likely this is normal. But you should pay attention to fatigue if it is new or dramatic. Here's what to watch out for. You are suddenly worn out after your typical exercise routine. You aren't exerting yourself, but have fatigue or a heavy chest. Simple activity like making the bed, walking to the bathroom or shopping makes you excessively tired. Although you feel exceptionally tired, you also experience sleep disturbance. If you experience all of this, seek your doctor as soon as possible to get better treatment. 5. Neck, jaw, and back pain. The last common sign of heart diseases is neck, jaw, and back pain. As intricate as our body systems are, they are very adept at giving signals when there is something wrong. When there is a problem with the heart, it triggers nerves in that area, but you sometimes feel pain elsewhere. Pain in the jaw, back or arms may signal a heart condition, especially if the origin is hard to pinpoint. For example, there is no specific muscle or joint that aches. Also, if the discomfort begins or worsens when you are exerting yourself, and then stops when you quit exercising, you should get it checked out. Well, if you experience any of the following 5 common signs of heart disease that I mentioned above, you should not ignore it. It's important to find out what's going on and to talk about what you can do to avoid a heart attack, so you can seek immediate treatment. Thank you for watching 5 common signs of heart disease. Early detection could save your life longer. Subscribe for more videos. Hope you feel better.